Hello, today I will be discussing the issue of whether abortion should be legal or not. In order to understand why the issue of abortion is so controversial, we will go over the history of abortion in the United States as well as exactly what an abortion entails. So, an abortion is a purposeful termination of gestation or pregnancy, and there are two different methods of completing an abortion. One method is the abortion pill, which is an oral method of abortion. The medications mifepristone and misoprostol cause a process similar to an early spontaneous abortion, otherwise known as a miscarriage. This method of abortion can be legally completed during the first 10 weeks of pregnancy. After the first 10 weeks is up, an in-clinic abortion is still an option. An in-clinic abortion is a surgical procedure in which the contents of the uterus are suctioned out. The doctor or surgeon will go in through the cervix and suction out the uterus that way so there aren't any incisions. Abortions have been present in the United States since the nation's founding. So through the 1800s, pre-quickening abortions were performed and advertised. A pre-quickening abortion is an abortion that takes place before the pregnant person can feel movements of the fetus. Also, abortifacients, which are medications used to end a pregnancy, were used by enslaved women in order to terminate unwanted pregnancies in cases of rape or coerced sexual encounters with white slaveholders. Before the 1800s, abortions were not regulated by the government, so doctors were able to perform abortions as they saw medically fit. During the 1800s, many states passed laws that banned abortions. These laws were passed due to fears of dangerous abortion procedures as well as moral concerns. The Comstock Law was passed in 1873 and made it illegal to publish information about contraception, sexually transmitted infections, or how to obtain an abortion. It is thought that the Comstock Law sought to ensure that white populations continue to reproduce because many people were concerned that newly freed slaves and immigrants were reproducing at a faster rate than white people. So the Comstock Law was a way to ensure that the white population would continue to reproduce and be able to remain the majority population. By the start of the 1900s, abortion was classified as a felony, meaning that it was illegal in all the states in the United States. Some states did allow limited exceptions for medical emergencies and cases of rape and incest. It wasn't until the 1960s that abortion became a hot political topic again. Through the 1960s and 1970s, anti-abortion and pro-abortion organizations protested the issue of legalized abortion. In 1962, children's television host Sherry Finkbein made national news as she sought to obtain an abortion. Ms. Finkbein was a mother of 4 when she accidentally became pregnant while taking the medication thalidomide. Since she was taking this medication that is known to cause severe congenital disorders, she decided that she would rather terminate the pregnancy than risk having a child who would suffer these disorders. Finkbein tried to obtain an abortion in her home state of Arizona, but she had to travel halfway across the world to Sweden in order to have a legal abortion. So Finkbein's story made national news and it spread awareness of a reason why abortion is important to have accessible, because not everybody can travel to Sweden to get an abortion. 2 years later, a woman named Jerry Santoro, who lived in Connecticut, passed away while seeking illegal abortion in her home state, where it was illegal, of course, because it was a felony. Around that time, there were also other stories of many women passing away or being injured because they sought illegal abortions. The Jane Doe Collective is an organization that formed around this time in order to provide safe abortions. Around this time, the case for legalized abortion gained some footing, and the first law to legalize abortion in certain cases was passed in 1967 when Colorado became the first state to legalize abortion in cases of rape, incest, or if the pregnancy would cause permanent physical disability to the birth parent. And then finally, in 1973, the famous Supreme Court case of Roe v. Wade made abortion federally legal up until 12 weeks since conception. However, even though the Supreme Court ruled on this issue, pro-life activists have not gone silent, and lawmakers have not ended their battle to snuff out availability of abortions. Since the Supreme Court now has a conservative majority after President Donald J. Trump's nominations, many are wondering if the decision of Roe v. Wade may be nullified by future decisions made by this conservative majority. And with the future of Roe v. Wade up in the air, the debate of whether abortion should be legal has been reignited. The Catholic Church, who is a prominent voice in the pro-life campaign, argues that human life begins at conception. They believe that, like adults, children, and infants, the unborn are human organisms from the moment of fertilization. Human sperm and ova, which are the male and female sex cells, do not have the potential to develop into a human because no matter how much time and nutrients are given to human sex cells, they will not develop into human organisms. While ova and sperm are not human organisms and therefore have no rights, a human zygote is a human organism and therefore has rights according to the Catholic Church. This distinction comes from the philosophy that since a zygote, embryo, and fetus all have the potential to develop into a human being when given time and nutrients, they have a right to life. In 2011, a case was made by Ohio Republicans to ban abortions after the embryo's heartbeat can be detected in an ultrasound. If this ban was successfully passed, it would stop pregnancies from being terminated legally at some point between the 4 to 6 week mark, because this is a time when the heartbeat normally becomes detectable via ultrasound. Laws similar to this one have been passed in some states, but they are not currently in effect due to federal courts and the Roe v. Wade decision. While some argue that life begins at a certain point in the development process, such as those who advocate for banning abortion when the heartbeat is detected, and those that wish to ban abortion after the moment of conception, many believe that becoming alive is a gradual process and that there is not one definitive moment when the unborn becomes a person. Arthur Caplan, who is a professor and founding head of the Division of Medical Ethics at New York University Langone Medical Center, states that many scientists would say they don't know when life begins. There are a series of landmark moments. The first is conception, the second is the development of the spine, the third the development of the brain, consciousness, and so on. Since a strong case for a specific definitive moment when life begins cannot be made, there is no way to regulate abortion based on such a moment, since it does not exist scientifically to our knowledge. To do so would be imposing one's own subjective beliefs on another. Not every woman that becomes pregnant wants the pregnancy. Many women believe that it is an honor to carry a child and build a life inside of our bodies, but not every woman feels this way. And to force a person to go through an unwanted pregnancy is to force her to perform painful and intense physical labor that will forever alter her body. The definition of a slave, according to dictionary.com, is a person who is the member of and wholly subject to another and forced to provide unpaid labor. If abortions were inaccessible, then women would be enslaved into having a baby once they became pregnant. Building a baby is hard, painful, and permanently body-altering. The female body goes through many changes and challenges throughout gestation, some of which include the following: pain in the back, abdomen, and groin area due to the uterus expanding, constipation, fatigue and sleep problems, heartburn and digestion, hemorrhoids, leg cramps, nausea, numbness or tingling in hands, stretch marks, frequent urination and urinary incontinence, varicose veins. Those are only the effects during gestation or pregnancy. Natural childbirth is one of the most painful human experiences there are. There is an option to get an epidural, but epidurals are not guaranteed to work. Epidurals can partially or completely fail, causing the patient to feel everything or part of the excruciating pain of giving birth. Some women are not even able to give birth vaginally. In these cases, a cesarean birth or C-section is required, which is an invasive surgery. This type of birth involves an incision in the lower abdomen and in the uterus in order to remove the baby. In many cases, a surgery may be deemed necessary and planned for when certain factors are present, including the following: certain medical conditions, including heart disease, diabetes, hypertension, or kidney disease; certain infections, including HIV or an active genital herpes infection; a congenital condition in the fetus; macrosomia, obesity; the fetus is in breech position, the mother's carrying multiples; placenta previa, placental abruption; preeclampsia or pre-eclampsia, eclampsia. In cases when a vaginal birth is planned, there may still be cause for an emergency C-section from conditions that arise during labor. Some of these conditions may be that the labor doesn't start, meaning that the cervix doesn't dilate even after 24 to 25 hours of painful contractions. Or labor may stall, which can be treated by Pitocin or another labor stimulator in order to start contractions. However, in cases where the head of the fetus is too big to fit through the pelvis, an emergency C-section is required. Another condition would be exhaustion of the pregnant person, fetal distress, umbilical cord prolapse, or uterine rupture. If the mother can have her baby vaginally, thus avoiding the invasive surgery of a C-section, there still may be post-delivery complications. Symptoms of post-delivery complications include the following: heavy vaginal bleeding, fever, dizziness or fainting, severe persistent headache, dysuria, which is painful urination, pain and swelling in the legs, worsening abdominal pain or new abdominal pain. So we have discussed many of the physical challenges of pregnancy and birth, which women would be unwillingly forced into if abortion were not available. These do not include any of the emotional or societal challenges, such as social stigma and emotional changes due to hormones. Though it is ideal not to have to terminate any potential for life, there is no way to ethically force a woman to maintain an unwanted pregnancy. Besides the ethical necessity to maintain an absence of slavery in the United States, the reality is that if abortion was illegal, approximately the same amount of attempted abortions would take place. The following quote is from a global report in the Journal of Obstetrics and Gynecology in Canada. Legal restrictions on safe abortion do not reduce the incidence of abortion. A woman's likelihood to have an abortion is about the same whether she lives in a region where abortion is available on request or where it is highly restricted. While legal and safe abortions have declined recently, unsafe abortions show no decline in numbers and rates despite their being entirely preventable. In that same report, Shaw and Ahmed state that maternal mortality rates, or the number of maternal deaths per 100,000 live births due to complications of unsafe abortion, are higher in regions with restricted abortion laws than in regions with no or few restrictions on access to safe and legal abortion. Therefore, since we cannot change human nature and should not employ slavery of pregnant women, the only ethical choice is to ensure access to safe abortions by legalizing abortion.